Welcome to Mental Health First Aid. My name is Denise Ellsbury, and this month we're joined by Ashley Quick. Ashley is a licensed clinical professional counselor at the Linden Oaks Medical Group office in Addison. She's a new clinical therapist there. So I'm really happy to have Ashley here today to tell us a little bit about that office, but most to talk with us about play therapy and doing counseling work with children, particularly younger children. So thank you for being here today, Ashley.
Oh, my pleasure. Thank you for having me.
Great. So just maybe tell us a little bit about your role at Linden Oaks, what you're doing at the Linden Oaks Medical Group office in Addison.
Yes, so I'm a clinical therapist there, and I see children from ages 3 to 10 would be my golden age range. And then I also see clients 16 years and older. And so we're a new location in Addison, part of Linden Oaks Medical Group, which has been just growing in leaps and bounds.
So you're there to do kind of like weekly outpatient counseling
yes.
for patients in that particular area?
Yes, weekly therapy sessions, and it could be every other week, depending on the client's needs. But yes, just outpatient individual therapy, or it could be with family as well.
Oh, nice. Okay. So what other kinds of therapy, this is a new office, so what other kinds of therapy experiences do you have or do you come with?
Yes, so I've worked in a couple, well, actually multiple different, kind of the whole spectrum of settings. I've worked in residential before, I've worked in a hospital, like partial hospitalization program, and then I've also worked in community mental health centers. And so it's just kind of, I just like to try everything, and anything new is an adventure, so.
Great.
And now it's more, this is more of like a private practice, so it's different, and yet it's been rewarding so far, and I'm really enjoying it.
Great. So we were here to talk about, you said your golden age range that you like to work with is kids age 3 to 10.
Yes.
So what sparked your interest about working with young kids?
So I've always loved working with kids ever since I was even a kid. I mean, when I was 12, I would help with the 4 and 5-year-olds class at church. So I've always had a passion for kids. And yes, when I was in graduate school, one of my professors was a registered play therapist.
Okay.
And so she had a class on play therapy, and I thought, and she was really passionate about it. And I thought, wow, I wonder what this is all about. And so I took the class, and then I'm like, wow, this is great. Like, I mean, it's a great field, and it's a great, I love working with kids, and it's a great tool to be able to work with kids, because they also have difficulties with just as sometimes the same as adults or similar to adults.
Okay.
So having the therapeutic means to be able to work with them as well it's been a great experience, and is helpful for them.
So you were going into counseling not necessarily thinking that, oh, I really want to work with kids, and after you took that class, it really was like, wow, here I can put two things that I really enjoy together.
Exactly, because at first I thought, oh, I think my ideal age range would be like young adult or transitioning young adult, and I was going to go to become a CADC, work with substance abuse, so I kind of did a 180. And after taking the play therapy course, I was like, I really feel like this is my niche and what I'm passionate about, and something that would be beneficial for children.
Excellent. So, people think kids, like, why would a young kid need to come into therapy? So can you tell us a little bit about, what are some of the concerns or reasons why kids come to counseling, and what are some of the things that parents are concerned about in terms of bringing their children in for counseling?
Oh, yes, those are great questions, because a lot of times parents are like, I don't know if my kid needs counseling or not, or even other therapists will be like, what do you do in counseling with a 3-year-old per se? And I've seen kids for just about as many reasons as I've seen adults for.
Okay.
Some, it may be just difficulty transitioning if there was a move or a change at school, at home, if it's a divorce situation or separation, that could be one instance, or it could also be like anxiety, just struggling with separating from their parent. That's another common, or their anxiety and just like worrying about something bad is going to happen to their parent or their family members. That's another common experience.
Okay.
And then it also can be to the other extreme of they're being changed in care, like a change in caregivers. So like maybe they're in the foster care system or they're being adopted. That's another reason why I've seen clients before. And unfortunately, of course, there are the cases of like where there's been abuse or neglect, or they've been witness to maybe domestic violence, or even parents arguing can be traumatizing for a child, especially depending on the age. So it's a whole spectrum of why people come in. I mean, it can be from the more minor incidences of just having difficulty transitioning, for example, from like kindergarten to first grade.
Okay.
And not having that playtime and having more of a structure. And it also could be if they're having behavioral problems at school. That's another reason that they may be referred, especially from the schools, because the teachers are like, I don't know how to handle this child, or I don't know how to best meet their needs and be helpful for them. So.
Is there one, I mean, I know you mentioned ages like 3 to 10. Is there one age range in there that you tend to see kids come in more, or is it really just the whole gamut there of young kids?
It does a lot of the whole gamut, although I have noticed like a lot of, especially at my last job, I had a lot of 5 and 6-year-olds, 5, 6, and 7. So that transition really from like going from kindergarten to first grade can be actually a difficult one for kids.
Sure.
In that there's all this structure now put in place for them, versus before it was more free play and fun.
Right.
So that can be, as minute as that may seem for adults, that can be really difficult for a child, and change is hard in general. So.
Sure. And that's kids are developing at such different rates that one kid might be ready to sit down and learn letters and words, and another kid not so ready to do that.
Yes, and I see a lot of the kids who have the hyperactivity or maybe difficulties with attention.
Okay.
So that's another reason why they come in, of like, and the psychiatrist maybe referred them, or their primary care physician referred them, because they're having difficulty paying attention or sitting still.
Okay.
So that's another very common concern, because that'll start to appear or become problematic around first grade.
Sure.
First, second grade, when there's now schoolwork involved.
Sure. I know there's a lot more discussion now for kids about sort of like those adverse childhood experiences.
Yes.
And you kind of mentioned that that trauma or being witness to trauma can be one of the reasons maybe why kids are coming to therapy, or why parents might be bringing children into therapy.
Most definitely, and especially now with bullying, just being, I mean, it doesn't even have to be physical anymore. It can be cyberbullying, bullying via text, social media. It's just, now it's kind of become this monster that's just grown. And so unfortunately, just now there are ways to bully besides let's meet after the school on the playground. Kind of like in person. So that's another thing that's brought kids in, and that's usually the older, maybe 4th, 5th grade.
Okay.
But yes, bullying definitely is still around, unfortunately, and now there are just even more ways that kids can bully each other.
Right.
So that's another common concern.
So are there certain behaviors or things that you sometimes would suggest to parents that they should watch for, that might be indicators of that, hey, here's would be a good time to think about maybe considering counseling for your child?
That's a great question, because a lot of times parents wait until it's more of like intervention, and I love prevention.
Okay.
So I'd rather see them earlier, even if they're even slightly concerned. I'd rather them come in and just assess where the child is at, rather than waiting till like they're pulling out their hair or they're scratching themselves or some kind of behavior
really
that cannot be ignored.
Yeah.
So that's a great question of, even if you're slightly concerned about maybe it doesn't seem like they're adjusting well to their new school, or they're not making friends, or they play by themselves, or when they do play, it's very aggressive.
Okay.
Anything like that would be a good indicator. And then there are also like, all behaviors have meanings, I believe.
Okay.
So if they're, yes.
So let's, I'd like to dig into that a little bit more. We need to take a break, but kind of talking a little bit more about some of those behaviors, and then really understanding a little bit more about like what you do in play therapy kind of thing.
Yes, of course.
Great. So join us after the break, where we hear a little bit more specifically about what happens in play therapy.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
Mommy.
Mija.
Llama al 1-888-971-2013 y obtén información para cuidar mejor a quien cuidó de ti.
Welcome back to Mental Health First Aid. We've been talking with Ashley Quick, who is a clinical therapist at the Linden Oaks Medical Group office in Addison. And we've been talking about play therapy, or getting into talking about play therapy.
Yes.
And when we, right before the break, we were kind of talking about things that parents can notice, or things that maybe they should be watching for that might be indicators that seeking counseling for their child might be a helpful thing.
Yes, and I just wanted to recap of,
Sure.
yes, of behaviors if they're acting out. So there are the children who will act out, and I mean, they may be physically aggressive towards other kids,
Okay.
towards themselves, and I am a very strong advocate of prevention rather than intervention. So if a parent is concerned, like if their child is like kind of withdrawing or being by themselves, playing by themselves, having difficulty making friends, maybe if they move schools, and just having difficulty assimilating to a new environment, that's definitely something to consider, that play therapy would be beneficial for them for. And then of course there's also the attention seekers who start acting out, because I believe all behavior has meanings, and so, and that's a way that kids communicate. They may not have the words to say what's going on for them inside, and yet they know that if I pull on my sister's hair all the time, I will get attention, or like,
Sure.
then they'll pay attention to me, even though, yes.
And I was going to say, it's an interesting, you know, that terminology, just to kind of reframe that is so helpful, right? Because sometimes
Yes.
it's like, oh, they're just doing that because they want attention.
Right.
Well, yes, but not so much because they're trying to manipulate you, but because
Oh,
they're trying to
yes.
communicate something to you.
Definitely, and they just a lot of times don't have the words to say, hey, I'm really hurting inside, or like, this divorce has really negatively affected me. I mean, I've never heard a kid actually come out and say, this divorce has
Sure.
really negatively affected me.
Right.
And yet it can be demonstrated in their play, and you can just see the hurt there though, and yet they may not know how to verbally communicate that. And so, like attention-seeking behaviors, hitting, punching, kicking, throwing tantrums even, is definitely a way to, that it does work to get attention.
Sure.
And just usually parents don't think of, oh, maybe it would be helpful if they see a therapist. They or lean more towards, oh, I need to punish this
Consequence or-
behavior. Yes.
So it sounds too like things for parents to pay attention to are changes in a child's behavior.
Oh, definitely.
So if it's been
Yes.
one way and then all of a sudden it appears to be something different, that's a time to pay attention to that.
Yes, most definitely. Or even if it's a gradual change, like maybe there was a death in the family, or even of a parent or a pet or a grandparent, that they may be in the initial stages of grief, just like for adults, like denial. So it may not be right away after an incident occurs, but then if there are changes in behaviors later on, that maybe could be part of that incident that occurred.
Okay. So help us understand a little bit, sort of like, what's the theory, if that's a fair question, what's the rationale or the theory for play therapy?
Most definitely, and I get a lot of questions about, like, you just have a bunch of toys and you're playing with my kid, and it's very different than that. Of course, you can have toys anywhere and play with kids anytime, and yet I compare it of like, the play therapy is to kids as talk therapy is to adults.
Okay.
So if you think of like an adult would go to a counselor and talk about what's going on, and they can usually verbalize or articulate, this is what's stressing me out, this is causing me anxiety, I'm feeling depressed, and so on. And yet for kids, because of their developmental age and where they're at, they don't have that like concrete, all that information and that vocabulary. Their language hasn't developed as much as like an adult would. So I've never had a client that's a child just come and sit down in my office and be like, so let me tell you what's wrong and what's going on with me and why I'm acting this way. So, and yet toys in play therapy, toys are their words and play is their language.
Okay.
So that's really where the work gets done, is that kids may, and it can be done many ways. They could reenact what's really problematic for them, or they may take out their aggression in play. They may have very aggressive play, and it's just figuring out kind of what's behind the aggression, like what's causing that.
Okay.
So it could be a number of things, but yet giving the child that power to be able to express themselves, and like that's what comes natural to children is play.
Okay.
If you ever watch a child, it's fascinating. Of just they will play and it's like they're in another world.
Uh-huh. Uh-huh. So it's almost saying, hey, instead of expecting that child to somehow have to adapt to the grown-up world and utilize
yes.
these tools or this helpful strategy, we've got to meet the child where they're at and be able to communicate
Yes.
with them in a way that is going to make sense to them.
That is a perfect summary of what it is, because even if it was an adult, you always want to meet the client where they're at. And so for kids, it's the same thing. I don't want to have that expectation that they need to talk to me like an adult, because they're not. And so whatever is developmentally appropriate for them, that I want to provide as something, a resource, so that they can communicate and express what's going on for them in their most comfortable way.
Okay. So you said parents ask a lot, like, looks like all you're doing there is playing
Yes.
with them. I'm guessing another question that you get from parents as well, how am I going to know if that's really making a difference or if that's
Yes.
going to be helpful? And so how do you answer that question for people?
So yes, I ask parents to give it a chance, and I do educate them on play therapy. There's a video I show them about just kind of summarizing what play therapy is, and I have a brochure that I give them as well. And of course, if they have any questions, I'll openly answer any of their questions. But yes, and I ask them to give it a chance. And also a lot of times they do know that that's how their kids communicate, just because they know their child and they don't have the words to like say, I'm depressed because of X, Y, and Z, or I'm feeling anxious because of this. And so, and parents will say like, I've noticed a change. And of course, how that change occurs, really, I feel like the child is the one that directs that. So I use child-centered play therapy. And so in the room, they're in charge. And that's very, I know that sounds ironic of like, so you let this kid just run around wild in the play therapy room. And I mean, if I don't set limits unless I need to, unless they're like writing on the walls, then of course I set a limit to that. And there's a technique to do that.
Sure.
But in the playroom, they're in charge, because nowhere else in their life do they get to be in charge.
Okay.
So it's very empowering, especially if they're struggling with low self-esteem, to use child-centered play therapy techniques with them. Just because that it helps them increase their sense of mastery, their self-confidence, all those things that they're lacking. It gives them that power and ability to work on in the playroom.
And that's very typical childhood development anyway, right? That's why
Yes.
kids play, is so they can practice things and
Oh,
develop
yes.
things like mastery and confidence
Yes.
through play. That's just normally what kids do.
Well, and sometimes they don't receive like the validation or the affirmation as I would be providing in the play therapy room.
I gotcha.
So if like, for say, if they're struggling with low self-esteem, I would identify things that they're doing well, even if it's something minor that maybe if they were just playing by themselves, that wouldn't have been pointed out. Or maybe they wouldn't have even recognized, oh, I'm able to do that all by myself. And so, yes, and then increasing their emotion identification, like their language about emotions, because that's essential. And so that's something if a client is playing with toys, and I'll say, wow, it looks like that doll is really angry at the other one. I wonder why she's feeling so angry. So just reflecting, never ask direct questions, and yet working on emotion identification is something that I do with all clients, just because at that age, they may not have the words or the language.
Sure.
So helping them place words and language with their emotions is very powerful for them.
So helping them kind of understand their internal experience and have a name for it.
Yes, and just like for adults, that's powerful if they're given a diagnosis of whatever it may be. They, a lot of times, because they have that word, that language, they don't feel alone.
Sure.
And that I'm not the only one who struggles with these symptoms of depression. Like it's something that a lot of people go through.
Yeah, great. So when we come back, let's talk maybe a little bit about what your play therapy room looks like.
Oh, yes.
So join us after this next break, and we'll hear a little bit more about some of those specific techniques and tools that are used.
Their support changed my life.
They were like family.
My voice is now heard.
A home for every animal.
My future is bright because they cared.
This is our home now.
Thank you to the 1,200 nonprofits that serve Cass and Clay counties every day.
Welcome back to Mental Health First Aid. Right before our last break, Ashley was telling us, beginning to talk about some of the more specific things that you do with kids in terms of the techniques or the toys that you use, that kind of stuff. So tell us a little bit more about that, and like, what does your play therapy room look like?
Yes, that's a great question, because a lot of times parents are wondering what kind of toys there are in there, and of course I show the parents the play therapy room, but there are different kinds of toys, and there are specific toys, so it's not just a collection of random toys. There are different categories, so there's the aggressive, expressive, nurturing, and real life toys.
Okay.
So having different categories, and then also in those categories there are specific toys that are recommended for a play therapy room.
Okay. So what are some of those?
Oh yes, for example, like I have a puppet theater in mine. Puppets, a lot of times that can be used in role play with children. Dolls, cars, vehicles, arts and crafts, like if they wanted to paint or draw or color, whatever that may be. And then I have dress-up clothes, so that'd be more of an expressive dress-up clothes. Yes, and that's also where all the puppets are. I'm just going around in the room mentally. And real life of like play food, play kitchen set, a dollhouse, and of course the furniture for the dollhouse and kitchen utensils and musical instruments is another one. Any way that kids can express themselves and communicate through that. And I also do have a sand tray, which I don't use with all kids because sometimes they can throw it around, or depending on the child's age. But I do have sand tray, which is about this big and wide, and I have hundreds of miniatures. So it's really a way that kids, and especially, and I've even used it with adults too in processing trauma, a way that they can create their world in the sand tray. And so that's another thing that I love doing with kids as well.
So just asking them to kind of set up whatever they want in the sand tray? And
yes, so I could go either way of like the world technique would be like, I wonder, what does your world look like? And just asking a client that, and especially for older clients, like teens I've worked with, you can get so much out of, especially teenage boys. They won't say anything in therapy at first, and then they'll create this world, and it's like, oh, I see your parents aren't in your world. I mean, it's just you can gather so much information about a person and just how they create their world and what it looks like. And
so you said you do client-centered play therapy, meaning that the kids can kind of go in and choose what they want to play with at any given time. And your role as the therapist is to do what?
So I am definitely attuned to the client and the child, in that like I'm reflecting their emotions and feelings, all of that throughout the session based on their words and their play. So I may be identifying, or if I'm working on them for like increasing their self-esteem or sense of mastery, working on identifying things that they did well while they're in their play. Or if it's for emotions, I'll be identifying, oh, it looks like that Barbie doll looks really sad, or it seems like she's sad. I wonder why she's sad. And just never asking direct questions, but we do a lot of I wonder. Just so that it's open.
And kids like stories, so kind of using the play to create a story and being able to talk about that story then.
And a lot of times kids will reenact or rehearse what's really going on for them. So a lot of times I'll see repetitive play, and actually the child doesn't need to be verbal at all. And that's one of the great benefits of play therapy. You can work with kids on the autism spectrum who are maybe nonverbal, or if there's select mutism, because they don't need to be verbal. And that they can, and a lot of times if they're reacting out the same scene every time, they're working through conflict. And that's their way of doing that. And so it may be a battle scene in the sand tray, it may be monsters and zombies attacking in the house. It could be a number of things, and yet that's just a great way for kids to process what's going on internally.
How do you involve parents in the therapy process?
Yes, great question. And of course, for anything in this field, it depends is the answer. There's not a clear-cut, dry answer. It really depends on what the client is presenting with. If it's more difficulty like parenting or a parent-child conflict, or the relationship isn't great between the child and the parent, I'll definitely involve the parent more and work with both the child and the parent on fixing that relationship or having a stronger attachment. And yet I've had other clients who are coming through foster care, who they're with the foster parent, they've experienced trauma themselves, and it wasn't due to in part of the foster parent. So I'll work more individually with that child just so that they have the opportunity to process their trauma.
Okay.
And so it really depends on the situation. And yet I always ask parents at the beginning, would you like to check in at the beginning or the end of the session?
Okay.
And I also do give them a parent session report form to fill out while they're waiting to indicate if there have been any changes at home, school, in their environment. And then we also I put on there the objectives that they're working on in treatment.
Mm-hmm.
So I may ask, like, how are they making progress towards their goal of having, instead of 4 to 5 tantrums a week, maybe 2 to 3 tantrums a week. And I'll ask them to rate how their child is doing based 1 to 10. 10 being like very much better, or 5 in the middle, and 1 like not good at all.
Okay. So even though parents might not be in the therapy room or the therapy session, they're very much a part of what's happening and
definitely.
relying on their feedback and their
Yes.
input as to what changes they might see.
Oh, definitely. The parents are a great asset for the child. And anytime if they want to work, if like, for example, a child has anxiety, I'll teach the parent the coping skills along with the child so that they can both practice at home in case the child forgets or the parent forgets. And also a handout explaining like what it is. So definitely parents are a huge asset.
Great. So before we finish, I want to make sure and have time to talk about like, it must be some extra training to be a play therapist. And then what should parents look for if they're like, wow, that sounds like something that would be a great fit for my kid? How do I know if someone is a play therapist?
Great question, because there is a lot of confusion on like who is a play therapist. And yes, because a lot of times it can also be misused of, well, I'm using toys and I'm working with a child, so that's play therapy, which isn't the case, of course. So if parents are looking for a play therapist, if they see that the person is a registered play therapist, that's a very good indicator that they're using play therapy correctly, or actually even using play therapy at all. And then also asking their background and their training. So to be a registered play therapist, you have to have a number of criteria, but at least 150 hours of education just on play therapy. So it does take years to become a registered play therapist. So, and also then you also have to have 350 hours of supervision with children clients, or have that many sessions.
So a registered play therapist is someone who has a master's degree in counseling or social work or something in along those lines, has some years of just basic clinical experience, and then on top of that, hours of practice, supervision, guided supervised work with kids.
Yes, so it is a lot to become a registered play therapist. There aren't a lot of us in Illinois, and yet if a parent's able to find someone, especially if their child is in the range of like ages 3 to 10, 3 to 11, that is ideal, just because that is their primary way of communication.
Okay, great. Ashley, this has been so interesting just to learn about play therapy, and I hope that parents that might be wondering what that's all about feel like this really provides them with more information. So thank you so much for being here.
My pleasure. Thank you again for having me.
Yeah, and thank you for joining us on Mental Health First Aid. And until next month, be well.